I think we're live. So we're live. Dr. Jason Cook here and Dr. Helen Pusat-Benazuz, and we're broadcasting live from Newington Medical. As much as possible, we are trying to respect social distancing. We are wearing a mask as well. I wanted to talk about masks. So, there we go. Yeah, I just want to talk about masks. So I think masks are probably underrated. The official advice is that you don't need a mask in public, but the good thing about having a mask is that it stops you from touching your face. This is the good thing about having a mask on when you're in public, because you could touch a surface or, things, right? I talked about fomite transmission. So these things are, right, Helen? Fomites. Things, right? Pens.
Sure.
Pair of scissors. Could be anything. So fomite transmission, and then you handle a fomite that might have been contaminated, and then you touch your nose. You don't even think about it. We do these things unwittingly. We don't even think about it. So that's why I think maybe it might be an idea. I know masks are in short supply, and it's a big problem, but it might be worth considering. Even if you have a washable mask, I think might be even worthwhile, because it'll stop you from touching your face. And the virus, we know the coronavirus, it can't get through your skin, right? The skin's a very good barrier. But it gets through your mouth and nose and eyes as well, right? So that's the mechanism how it gets into the respiratory tract. It has to get through your mouth, eyes or nose, right? And so if you're touching, people don't usually stick their fingers in their eyes, so it makes it unlikely. It's nose and mouth. People always like touching their mouth and their nose. They can't help themselves. Like this, and they just can't help themselves. That's why I think a mask might be a good idea. I don't know, Helen, do you concur or?
I think mask is a high risk,
right.
Because if you touch your face and the mask continuously, you actually can contaminate yourself. Therefore, I highly recommend you to make sure that you clean your hands. It's way more important than the mask itself, and not put things in your mouth, okay? But it's just, the mask will prevent you from spitting at each other.
That's true too.
And also, rubbing your nose without any kind of protection.
Yeah, so microdroplet spread when you speak is something that we also should consider.
Yeah.
So Helen, can you talk about
the
children? Yes.
Yeah, so I have been involved with in the hospital number of meetings, like every single day we have meetings about coronavirus, and to date I do not know about one case in intensive care. So we would have heard about it, but I don't know about one confirmed case in intensive care of a child less than 16 years of age. Okay?
That's fantastic.
In a couple of days ago, though, there was a New England Journal of Medicine publication about the China population, and they tested 1,391 children. And out of those, 171 were positive. Interestingly, actually 90% were actually family members who were sick, and then the child was also sick. So it was not only just a random child having illness. And as I said, most of them were even like family clusters, so everyone in the family was sick. Right. Now, cough was most prevalent symptom, so 48%, so almost half of the patients had cough, and fever was in 41%. However, they recorded the fever also to be 37.5, and we in the hospital for pediatric population say that the fever actually starts from 38. So majority, lot of children had actually sort of low grade fevers. Don't want to scare you about it, though. What they did say though is that lots of children who had confirmed coronavirus were very asymptomatic, and I'm repeating exactly the same thing that I repeated last time, is that the child can have a virus, have no symptoms, and can spread this virus. So by just putting things in their mouth and giving kisses and hugs to the grandparents. So when you're staying home, please keep your child with you at home and do not take the child to the grandparents. That's the most important thing. And if you have to go and see a grandparent or a family member, make sure that your child is the one who wears the mask. So at the moment, if you come to a pediatric clinic in the hospital, we actually give masks not to the parents who have no symptoms. We give it to the children because they are the ones who can actually spread it. Okay? That's what I wanted to say to you.
Okay. Asymptomatic carriage and transmission is
exactly.
rife, in fact.
Yeah. And, kids can get sick, and how many viruses in one child? I think the maximum I have seen was 5 different viruses in one child, so it takes them a while to recover from this illness. So lots of the children, there was another publication, lots of the children majority of the children had a number of different viruses at the same time, and therefore they were quite unwell due to those multiple viruses. However, coronavirus can cause a pneumonia still, and can cause sort of a upper respiratory tract illness in children as well, but it is probably more common in children who have other viruses at the same time.
So coronavirus is an opportunistic infection as well?
In the children.
In children.
That's exactly.
And also they can be spread very easily as well to adults.
That is exactly. Yeah.
So let's talk about the issue of school closures. I mean, given what you've just told us, Helen.
Yeah.
Where do we stand with schools? I mean,
I think it's a controversial history, a problem. In my opinion, I think as we are facing quite a severe coronavirus outbreak in Australia, as you can see, the trend of Australian people who are getting confirmation that they have coronavirus is going up rapidly, and the same course is going Italy. And I think school is the place where children who, as I said, are asymptomatic. What if a family member of a symptomatic family sends a child who is asymptomatic to school? They can give it to another child who is asymptomatic and takes that to their family. So I think in current state and day and age, I highly support you keeping your children at home. Now, it can cause a lot of problems. You have every single day, 5 days a week, you send children to school and you go to work, and then suddenly you have to look after your child again 5 days a week. So it is so important for you to sort of have a certain kind of routine when you're doing schoolwork, when you're going sort of doing some running around and playing. So it is so important to keep your sanity, to have sort of a routine and schedule for your days. Make sense?
Very much so. Yes. Okay, so we have this issue with children being vectors of transmission, which we discussed in the previous video, and this is a significant issue, and especially when it comes to schools, because we've found that kids, and not only that, we can't test everyone. We cannot know for sure how many cases are out there because our testing criteria are quite limited, and our testing kits are limited as well. We really have to assume everyone potentially is infected.
And I don't think it's necessary to get it tested unless you have symptoms, because as soon as you walk out of the testing place, if you do not keep your hand hygiene and don't keep your hands off your face, it's likelihood that you will then infect yourself. However, you did test 5 minutes ago and that was negative. So I highly recommend people to only test when they are positive, when they have respiratory tract illnesses and symptoms of runny nose, cough, fever, and sometimes also other symptoms as well. Okay? Because otherwise you will have to test again when you develop actually symptoms, but you say, oh, but I was coronavirus negative. Doesn't mean anything then. Okay?
Universal precautions.
That's exactly.
So universal precautions, social distancing, hand washing. If you have cough, cover your mouth, or preferably, leave the room.
Yeah.
All these kind of things are critically important when it comes to arresting this scourge, this absolute scourge on the earth that has been released.
Yeah.
Our attitudes to infection control as Australians are, I think, pretty horrific, to be honest. Honestly, like seeing Bondi Beach the other day and everyone commingling, and it was unbelievable. Unbelievable how laissez-faire Australians are about this matter. This is SARS. Let's make no mistake. This is the reincarnation of SARS. The death rates are around 15%.
Yeah.
You know, so 15% death rates. This is a very, very serious matter. We need to take infection control much more seriously.
Yeah.
In order to arrest this. Otherwise, we're going to be in for a hell of a time.
Yeah.
And
the hospitals are suspecting that they would have up to 7 or 5 to 10 intubations per day if they are lucky. Okay. And if they are not lucky, they will have up to 20 intubations per day, and we are talking about adults. So this is going to be severe if we do not do anything now. We have to do it now. Okay. It's very important.
Yes.
Can we finish it now?
Gloria Mitchell has asked, can you get the COVID virus if you have it already and beaten it?
No.
So,
we genuinely believe that you will develop immunity to it. It's like you getting a flu vaccination and you're less likely to get a flu, but you can still get a flu that you didn't have or your immunization did not cover for.
Right. Excellent. Well, that's good news.
Yeah.
So this is a very serious matter. This is not a flu. I wish they had called it SARS Part 2, because this is what it is. It is SARS. Look up SARS. SARS. Back in 2002. This is the reincarnation of SARS, and in fact it's worse because the death rates, as has been proved in Italy now, are higher than what we thought. They're up in order of 15% of completed cases. So you know, it's a very, very serious matter, and that's why we're going to this unbelievable amount of social distancing. This is unprecedented in history, really. For that reason, you know, I would just ask everyone to look up SARS and what happened. Fortunately, that was arrested. This has gone out of control. This is like unbelievable, and it's an absolute catastrophe at so many levels. We need to arrest this as soon as possible.
Yeah.
So I would just ask everyone to respect universal precautions. Assume everyone's infected. Everyone in the street.
Yeah.
Assume they've got coronavirus, especially children. Okay.
That is exactly.
So I think that will be the take-home message. Assume everyone's infected and diseased. And we need to keep our distance and prevent the spread of this scourge any further. Okay, so we'll try and update periodically, maybe as new information comes to hand. So it's good night from Dr. Helen and Dr. Jason.
Bye.
Good night, everybody.